Hello, my name is Mari Cooke. I'm the Deputy Director of the Centre of Health Practice Innovation within Griffith Health Institute. Much of my research at the moment is looking at clinical interventions that have an impact on distressing symptoms for people, whether that be in hospitals mostly, but I also am doing some research with people in the community. I have a clinical background in acute and critical care nursing. I obviously did some research in my postgraduate studies, and one of the things I was looking at that time was stress. Then when I moved into my academic role and I became a visiting scholar at a metropolitan hospital here in Brisbane, a clinical nurse came to me with a clinical problem, and I started looking at what interventions would make a difference here to the people who are having day surgery. And so I started clinical intervention trial work, and so my whole background now is really doing clinical trials, using interventions that have hopefully an impact on reducing distressing symptoms for patients, individuals and people in the community. I undertook a randomised controlled trial in 2 residential aged care areas. I was looking at trying to improve the mood of people with dementia. After the project finished, I had a lovely letter from a resident's daughter. In it, she explained how she was so pleased her mother had been involved in the project. It had made her last days more cheerful. They could tell when she'd been to a music session, she was joyful, she was happy, and she kept singing throughout the day. And so for me to get a letter from a resident's daughter to say that, you know, her last few days were made different, her mood had improved and her quality of life was better, was an important outcome. The relationships Griffith University has with healthcare settings for me, particularly the Gold Coast Hospital and Health Service District, but certainly also up here in Brisbane, has helped me make linkages to clinicians and to clinical problems that I want to have a part to play in terms of trying to come up with interventions that might help reduce distressing symptoms for people.